Hey there, everybody. Hope your Thursday's off to a great start. Here it's a little bit rainy, so it's not that pleasant outside, but hopefully wherever you guys are, it's much nicer than that. Um, but we got one day left of the week, and then it's the weekend, so hopefully you guys are on the countdown for that. And today we're going to be taking a look at preventative care. So without further ado, let's jump on in. So there's a lot of confusion around what is preventative care, what isn't preventative care, um, and preventative care helps reduce the risk of diseases and disabilities and death. Yet millions of people a year don't get it, and there's a bunch of different barriers to this. Part of it can be cost. Sometimes people don't have a primary care provider. Sometimes because they live too far away from where providers are. And also there's a lack of awareness around preventative services. And so this is where teaching people what these services are, letting them know, hey, you can go get these done, is so important. And so there's been laws and policy changes in recent years that are aimed at doing this. One of them, the Affordable Care Act, or the ACA, is been incredibly helpful in this, and we're going to sort of go into why that was so important here in just a little bit. And then the Healthy People 2030 is really focusing on increasing preventative care for people of all ages. So, what exactly is preventative care? Preventative care is the stuff that you do before you get sick to help you stay healthy. So this means you're trying to prevent diseases and other chronic conditions by actually going to the doctor when you're well. And this is great for a couple of reasons. Obviously, this means that you're more likely to not have long-term conditions because you're going to be screened for risk factors and then can start treatment early. And this is going to lower your overall healthcare costs overall, and it's just going to keep you healthy overall over the long term of your life, which obviously that's the main goal, right? We all want to be healthy to be able to do the things we want to do. No one wants to have to deal with chronic conditions and all of the side effects that come with that. You know, you've got to take medications, you've got to go to regular doctor's appointments. Usually if you have one type of condition, you're at risk for developing others, and then you have all the complications and stuff that come with that. And so preventative health screenings, preventative care is designed to help not prevent you from having those things, hence the name. Um, so this is why it'll help catch high blood pressure, help diabetes, certain types of cancer early in the process, essentially when they're still treatable before they get out of hand. And this means that the benefits of preventative care are numerous. Obviously, the most important one is that it can extend your life, literally, because of the fact that you're able to prevent these diseases that you don't want to have anyway. So the more proactive you are in seeking preventative care, the better it will be as far as your outcomes. You're going to know more about your health. You're going to know about more techniques to keep yourself healthy, and that's always a good thing. So you want to take measures into your own hands and obviously start preventative care. And there's some stats here. Routine cardiovascular exams save thousands of lives every year. Vaccinations save about 42,000 children annually from dying. And preventative health screenings obviously increase life expectancy, but particularly among those who are 30 to 49. And since I fall into this age group, and some of you do, some of you are a little older, some of you a little younger, I mean, this is important. We want to be able to have a long, healthy life. So this is where the health benefits are amazing. So when you do preventative care on a routine basis, but the other factor is obviously the cost. I mean, who doesn't like saving money, right? And so the preventative healthcare helps you save money in a couple different ways. One, obviously, if you're not having to deal with chronic diseases, you don't have the long-term costs of paying for the diseases and all of the things that go with that, you know, medications, doctor visits, all those things. And if the second is that most insurance companies cover preventative care completely. So there's no out-of-pocket cost to get these screenings done. And this change is thanks to the Affordable Care Act, which is why it was such an impactful piece of legislation, is that by covering it, it's just the cost of preventative care. The hope is that it would encourage more people to seek preventative care so that way they're not having to worry about, the financial burden of going to the doctor. Um, so when you go for an appointment, your doctor's going to go through, what's your current health status. They're going to look at your family history. They're going to want to know all these things because if you have a family history of cardiovascular problems, then they know that maybe you need to be screened for those problems. That way they can catch anything that, you potentially could have something. And this allows to be able to control certain risk factors like diet, nutrition, and all of that as far as physical activity as well, that if you don't go to the doctor, you're not going to know, hey, I should maybe change what I'm eating, or maybe I need to increase my physical activity or change what type of physical activity I'm doing. So this is why it's so important. And then, so as far as examples go of preventative care, one of them is obviously your annual checkup at the doctor. And this includes everything that we were just talking about, that's screening and all that. But preventative care can also include screenings for cancer, mammograms, pap smears, any test for PSA test for men, the prostate-specific antigen tests. All of these are also can fall under the umbrella of preventative care. Childhood immunizations, adult immunizations, such as like your flu shot every year. All of that is part of this process of trying to keep you healthy. So the actual definition of what is considered preventative care, it's when you don't have any symptoms or abnormal studies that indicating that there's something wrong, or you're getting screenings done based off the recommended guidelines based on your age and gender, and then you're having a diagnostic service that has normal results, and so that's the general gist of it, is basically you're having some sort of either exam, test, something done, either based off of your age and gender, or because you're just going because you're healthy and you're following up with your doctor. So diagnostic care, which is when you go to the doctor because there's something wrong, essentially. And so this means if you've had an abnormal result on a previous screening that was a preventative screening and you need further testing, those further tests would be diagnostic tests, because at this point there's now a problem or an abnormality and your doctor's trying to figure out, okay, what is it? What do we need to do here? And obviously, if you have symptoms of something, then that's a diagnostic test. So, I know that's sort of a little confusing, so I want to give you an example of that, hopefully to clear this up a little more. If you get a colonoscopy as a colon rectal cancer screening, that's preventative care. Even if the doctor removes any polyps or tissue while they're in there, it's still considered preventative care. However, if you need additional follow-up care after that, because the doctor needs to go back in and remove additional growths, or if you need any treatment because the cancer was detected, then that is now considered diagnostic care or treatment. So that's the two main differences there. As far as your health insurance, the way they term it, you have preventative care and then you have medical benefits. Medical benefits basically means they're covering the diagnostic care or the treatment. Preventative care is exactly as it sounds, preventative care. So when your doctors are going over, what screenings you should have done, they usually base it off the United States Preventive Service Task Force, or USPSTF. And this organization is what gives the guidelines for preventative screenings for your age, gender, and such. So sometimes medical benefits will cover other screenings that your doctor recommends, not just, what the guidelines say. So this is where knowing what your insurance company covers is so important, because obviously if you don't, then you might end up having a bill that you didn't expect. However, as I said, thanks to the Affordable Care Act, most health insurance companies will cover any preventative health screenings, tests, exams at 100%. So this means there's no cost to you. So this means you're not paying a copay. This means there's no sharing of costs, so there's no co-insurance, and you don't have an amount to pay yourself before your plan starts. So this meaning there's no deductible. So this is why going to the doctor, it's basically, I don't want to say risk-free, but there's no cost. So this is why you want to go get preventative care. It's not going to cost you anything financially, and it could obviously reap huge benefits health-wise because you're preventing potentially something from happening in the future. So and this is where you either have to know sort of what your doctor's recommending, and this is why the guidelines are so important, because some things that are covered as preventative care when you're younger aren't covered when you get older due to a decrease in potentially developing those conditions, and then vice versa. Sometimes some things increase as you age as far as your chance of developing it. So what was not preventative care then becomes preventative care. So if you're not really sure, this is why reaching out to your insurance company is so key. So that way okay, I'm going to go to the doctor. I need to, they're recommending I have these tests done because, I'm a woman who's 30 years old versus, a man who's 50 years old. Then that's where, knowing that information before you go can help you plan. But overall, the big thing with preventative care is you just need to go get it done. I mean, you need to make time for it, and that's why it's so crucial because, I mean, you can get the benefits. Who doesn't want to have a long, healthy life? And all it takes is maybe going to your doctor once a year. So on that note, and remember, life happens fast. I get it. But your health, it's a serious thing. You want to take it seriously. I mean, without it, it can significantly impact your life if you're not in good health. Take the time to pay attention to your body. Listen to it. If you think something's wrong, go to the doctor. And obviously that might not necessarily be preventative care, but it's still important. You still need to go to the doctor if you're not feeling 100%. But definitely get yourself scheduled for an appointment for your preventative care, annual checkup, or anything else that you need to have done. Don't wait. I mean, this is so crucial. I can't stress this enough. Don't wait. Go get it done. But that's pretty much everything in a nutshell. I know today's a little bit shorter video, but I figured sometimes obviously some of the videos go a little longer, so we'll keep this one nice and condensed. The message is pretty simple. If you haven't had your preventative health screening for the year, go get it done. If you guys have questions, comments, I'd love to hear from you. Send me a message, put them below. Otherwise, I will see you guys next week. Have a good rest of this week. And until then, you guys stay healthy.